Okay, Brian, feel free to begin anytime.
Great, thank you. Good morning, everyone. So my name is Brian Busching, and I work with the Indiana State Department of Health, Tobacco Prevention and Cessation Commission. Today, we're going to learn a little bit about the Indiana Tobacco Quitline and the services and programs that are offered through the Quitline, and ultimately how you, as an IRHA member, can refer to the Indiana Tobacco Quitline, or at least feel comfortable talking about the Quitline and sharing that information with potentially an interested tobacco user who is trying to quit and just looking for a resource to help them quit. So without further ado, I'll go ahead and jump in here. The overview, so we're obviously going to discuss a little bit about the Indiana tobacco burden. We're going to talk about the Quitline services and programs, and then, as I mentioned, finally intervening with a tobacco user, depending on what your role is as an IRHA member. I think there's a lot of different ways that this information can be applied to your different or to your specific sector. So I think we're all probably pretty familiar with the burden that tobacco use places on the state as a whole, but here are just a few brief statistics to really put it into context. You can see that tobacco use accounts for over 11,000 deaths annually in the state of Indiana. Our adult smoking rate is about 22.9%. That's 2014 data, so more than 1 in 5 adults report smoking. You can see that for every death, 2 new youth start and 30 are living with a chronic disease. So we know a lot of the negative health outcomes associated with tobacco use. It's basically connected to really all chronic diseases. But when you shift gears and start looking at the economic burden that it places on all Hoosiers, you can see that nearly $3 billion in annual healthcare costs, $590 million in Medicaid costs. As taxpayers in the state of Indiana, pay about $982 per household to treat tobacco-related disease. So even if you're not directly connected with a tobacco user, whether it be a family member or a friend, we as a state still are paying the bill, if you will, for those tobacco-related diseases. So a huge burden that's being placed on the state just due to tobacco use. Some priority populations that we are very, very much interested in here at TPC is obviously the pregnant population. You can see here that in 2014, 15.1% of pregnant women in Indiana smoked at any point during their pregnancy. That's actually down from 2013. It was 15.7. But on that third bullet point, you can see that we are still almost double the national average, which comes in at about 8.4%. So definitely a priority population for us. As we kind of get into the Indiana-specific disparities among the pregnant population, probably not that uncommon as we think through where we typically see those tobacco users, but you can see that it's much higher among Medicaid-insured women. It almost it's at 25.3, so almost triple that national average, if you will, or the average skyrockets to 25.3%. So really 1 in 4 women who are pregnant and on Medicaid report smoking during that pregnancy. That's a big deal. And you can see here that about 1 in 5 of them live in rural counties. So, we definitely have an issue, and it's trying to get these services to these hard to reach areas of the state to where we can make sure we're connecting these women and really all tobacco users to a cessation resource that we know can help them quit when in fact they are ready to try to quit. So transitioning to what we're really here to talk about today is the Indiana Tobacco Quitline. So this is a free cessation counseling service that's aimed at helping smokers quit in the state of Indiana. And it doesn't just have to be smokers. The Quitline will talk to a participant about any type of tobacco use. So whether it be smokeless, spit, any kind of other tobacco product, electronic devices, they will be trained to talk to that individual to help them throughout their quit continuum. As I mentioned, it is phone-based one-on-one coaching that's offered throughout a person's process while they're attempting to quit. Getting into a little more detail with the Quitline, it is toll-free. We know that it's evidence-based. There's plenty of research out there that suggests this approach is a beneficial and effective approach. So telephone counseling paired with medication support. One of the staples, and really the staple of the program, are the highly trained quit coaches. So these are the individuals that a participant is going to be talking to as they work through their quit plan. They are highly trained in cognitive behavioral, have over 240 hours of training. I think another nice feature of the Quitline is you can see here that Spanish speaking competency and offered in over 170 other languages. So if there's any kind of language barrier, I think the main thing is to know enough about what the Quitline offers and still get that participant connected, because once the Quitline gets to that individual, they'll be able to take care of any kind of language issues. So also educated up to a graduate level, and over 50% of them have 3+ years prior experience in counseling. There's some nice vignettes or short videos on quit coaches at quitnowindiana.com. So I think it's always helpful to know that that information is out there. Anybody who's interested, maybe not sure about being referred to the Quitline, tell them to visit quitnowindiana.com. And there's a lot of great information on there that hopefully will help put their minds at ease and push them over that hump, maybe to get them to actually get connected with the Quitline. So with the programming options through the Indiana Tobacco Quitline, the standard program is for anyone 18 years and older. They get 4 prearranged calls with a quit coach. So when I say 4 prearranged calls, I mean that they're going to be outbound calls from the Quitline, so scheduled quit sessions, if you will. You can view it as a counseling session. I know some people don't like to hear counseling, but it's a prearranged appointment with the quit coach where they're going to have a session throughout that individual's quit plan. So that's for anyone 18 years and older. They get 4 outbound calls. Important to note that a tobacco user can call into the Quitline 24/7. So it is available 24/7. They may not be connected with their quit coach that they're having the 4 prearranged sessions with, but they will be connected with a highly trained quit coach that will be able to pick up where they're at and at least answer those questions or help them through whatever that issue may be for that day. If there's a trigger, something happened, they just need to talk to somebody, they can pick up that phone and call in 24/7. There's a special program for the pregnant population. They get 10 outbound calls, or 10 sessions, if you will. We're going to go in this a little bit more detail in the next slide, so I don't want to give away too much, but special program for the pregnant population, and they get 10 outbound calls. There is a program for the youth population. It's 13 to 17 years old. They get 5 outbound calls from the Quitline. We do offer 2 other platforms in which to stay engaged with the Quitline. One of them you can see here is web coaching. We'll get into that a little bit later in the presentation. We also offer a text-to-quit service, which is a cell phone-based service that keeps someone engaged with the Quitline. And then additionally, aside from the telephone-based counseling, the web-based counseling, or the text-to-quit service, we do offer medication support in the state of Indiana. So all quit coaches are trained to have the discussion about nicotine replacement therapy or the prescription-based options for medication support. But specifically in the state of Indiana, we do offer a 2-week supply free of charge to anyone who's uninsured, on Medicaid or Medicare, a 2-week supply of NRT in the form of gum or patches. So quit coaches will discuss all 7 FDA-approved medication supports, but to get a free supply, a starter kit, if you will, 2-week NRT gum or patches for anyone who's uninsured, on Medicaid or Medicare. Again, a lot of research out there that supports counseling along with medication support can really help somebody get through that tough time of quitting and hopefully break free of that tobacco addiction. So the 10-call program for the pregnant population, you can see that it's going to take a woman-centered approach. So it's going to emphasize not only the benefits of quitting for the mother, but also for that developing fetus. It's also going to encourage, let's say a pregnant mother is living in a situation in their home environment where their spouse, their partner, their relative is also a tobacco user, going to encourage that individual to get them enrolled in the standard 4-call program. Typically, this is the way the calls are structured. It's usually 5 to 6 within the first 60 to 90 days just to get a good foundation. There is a call 30 days prior to that planned due date. And then after birth, there are 2 postpartum calls at 15 and 45 days after that date of birth. So really trying to make sure they have a good foundation, keep them engaged throughout their pregnancy, and then the 2 postpartum calls to keep them hopefully tobacco-free after they give birth to their child. So as I mentioned, not only importance of quitting to the pregnant mother, but also for that developing fetus, and to encourage anybody else that maybe is in their circle to get enrolled with these services and hopefully get help quitting. The Quitline services for youth, very similar to the standard program, but appropriate approach to this counseling. So 13 to 17-year-olds obviously have a lot different circumstances than maybe an adult smoker. So they're going to definitely make it age appropriate for that population. They're going to talk about those peer influencers, but just to know that the 13 to 17-year-old population does have a resource available to them if they're experiencing kind of those initial stages of thinking about starting tobacco use, or maybe they're with a peer group that you're not cool if you don't use tobacco or everybody's doing it. And that counseling approach is going to be a little bit different than it would be for somebody who's used tobacco their entire life and smokes a pack a day. But I think the big thing to recall here is just that there is a resource for the 13 to 17-year-old population through the Indiana Tobacco Quitline. I always like to show this diagram because it's a nice flow chart of what a participant can expect. You can see that if someone gets connected with the Indiana Tobacco Quitline, they'll discuss some very, very basic information with an intake specialist, and then they have the opportunity to be directly transferred to their quit coach for that first quit call. If they don't want to do that, they just want to get enrolled and then maybe set up a date, in a week or so to get called by the Quitline, they can do that too. But again, this flow chart just shows a nice, or gives a nice depiction of what a participant can expect if they do get enrolled or referred to the Indiana Tobacco Quitline. So when you know that the program works, this is an evidence-based approach. It is grounded in CDC's best practices for comprehensive tobacco control programs. Some of the reasoning behind our understanding that this is a program that can be successful is obviously the personalization of the program, so the ability to quit at your personal pace. You're going to set up a quit date. You're going to talk through what your challenges are, what your barriers are, and why you think it's important for you to quit. And that plan is going to be something that you can follow, all with the help of the Indiana Tobacco Quitline and a highly trained quit coach. You're going to conquer those urges to smoke. We understand that there's a lot of triggers, a lot of habits that people get into when they are addicted to tobacco. You're going to talk through that and determine what are some good strategies to help cope with those situations and overcome them. Obviously, the use of medication support, as we already mentioned, and then ultimately the end goal, which is to become a non-smoker for life, not just to quit and then pick it back up. We do understand, and the Quitline understands, that it usually takes about 7 to 10 quit attempts for a smoker to ultimately become a non-smoker. So they're going to understand that. They're going to empathize with them and work through this throughout the entire process. I also like to show this. This just gives a nice snapshot of call volume to the Indiana Tobacco Quitline. You can see it kind of ebbs and flows there. Typically, when we have those higher call volumes, it's when there's either a state media campaign or a national media campaign, such as CDC Tips from Former Smokers, that's currently running nationwide. So you should be seeing some broadcasts of TV commercials from some of those participants. But I think it's really hard hitting. It shows what can truly happen, and it shows the impact that tobacco use has had on these people's lives. So that typically generates a little bit more buzz around quitting and the quit line, especially if those are tagged with call 1-800-QUIT-NOW, which a majority of them are. But I just like to show that it does ebb and flow, and it's media can be a very, very strong factor when you're talking about Quitline call volume. So about the Quit Now Preferred Network, this is more or less a database of interested healthcare professionals, employers, and organizations that we have enrolled into this network that basically states that you've met with myself, you've met with other TPC staff, you've met with our partners, that you're familiar with the Quitline, and you want to refer your patients, your employees, your friends, your family to the Quitline to get them the help that they deserve. So multiple benefits. As I mentioned, it gives you access to myself. It gives you access to other TPC staff. We have partners in 36 counties across the state. It gives you access to them. You have the ability to fax refer patients, friends, employees into the Indiana Tobacco Quitline. We can give you feedback on what takes place with those referrals. Unlimited ability to order free materials to put in your clinic, your office, whatever it may be. Just a lot of good stuff to stay connected with everything tobacco control, but specifically everything Indiana Tobacco Quitline. You enroll in this program, you're not going to get bombarded with emails. It literally is just a way for us to know that we've made outreach to you, you were interested in, and you signed up to be someone that's going to talk to your patients, your employees, your friends about the Indiana Tobacco Quitline. So shifting gears on how we recommend you get the conversation started, the intervention to get somebody interested in quitting, or at least find out if they are interested in quitting, and then get them referred to the Quitline. So you may be aware of ask, advise, refer. First piece is obviously ask, depending on what your setting is. So if you're a healthcare provider, if you're an employer, if you're just an interested organizational member, you have to have the conversation. So you have to ask, have you used tobacco products in the last 12 months? Have you used tobacco products in the last 6 months? But it needs to be everyone, every patient. It needs to be routinely, and it needs to be very non-judgmental. So you're just starting the conversation. I would say a majority of tobacco users, I think it's anywhere from 70 to 80%, actually want to quit and expect, for instance, a healthcare professional to talk to them about this. So they're going to be expecting that conversation. You're going to know best based on your environment, your setting, how to approach this conversation, but the ask needs to be made. So you can see here just some examples. As I mentioned, have you used tobacco products in the last 12 months? Here's an example that gets more at the family exposure. Are your children exposed to secondhand smoke? Whatever makes the most sense for your setting. The advice piece is really one of the most important pieces. You want to make this clear, you want to make it strong, but you want it to be personal. And again, we have some recommendations here, but I think you as the provider, you as the employer, you're going to know how to approach this conversation. And there's a lot of different ways that you can make it relevant to the individual. But I think the last piece of these examples is what's the most important. So you can see here, it's important that you quit as soon as possible, and I can help. Quitting is the best decision you can make for your health and the health of your family, and I can help. You're letting somebody know that there's something out there for them and that you directly are there to help them if they are indeed interested in quitting. You can talk about the health outcomes, so the negative burden that it places on the individual's health. You can talk about the connection to the negative effects that it's maybe placing on their family, or what kind of role model, what kind of role model or example are you setting? When your kids see you smoking or using tobacco products, you can connect it to the financial aspects. So you're going to be able to save a lot more money if you quit using cigarettes, and I'm here to help, and I can help. And ultimately, what are we getting at when you have this brief ask, advise, refer? We want you to refer them to a cessation resource. For this PowerPoint, obviously, the Indiana Tobacco Quitline should really be that first option because of its accessibility, because it's free, because you can get free medication support in the form of that 2-week supply. But if there's other resources available, absolutely talk about those other resources. I think, at the end of the day, we're all here just trying to help somebody kick that habit, break that addiction from nicotine and that tobacco product. But refer to the Quitline, and how we recommend you do that, depending on your setting. There's a couple different options. You can make a direct referral to the Indiana Tobacco Quitline. In my next slide, I'm going to show you a fax referral form that we provide free of charge to anybody who's interested. But just a few notes here that if you're going to refer somebody directly to the Quitline using that fax referral form, they really need to be 30 to 60 days ready to quit. That shows a level of motivation that they are ready and that they truly want to try to make a quit attempt. If they fall outside that 60-day range, it doesn't hurt to have the discussion and maybe hand them some of those free materials that we can offer you, just to keep it in front of them, to let them ultimately think about it and make the decision. If you do refer somebody to the Quitline, they will be contacted within 24 to 48 hours. This is specific to that fax referral form that I'm going to show you. And that they are going to get an outbound call from the Quitline to engage them in services, and it's probably going to come from an unknown number. We've heard different stories or varying stories from the field that sometimes it pops up unknown, sometimes it pops up 1-800-QUIT-NOW, sometimes it just pops up the 1-800 number that 1-800-QUIT-NOW breaks down into. So just making that individual feel comfortable and aware of what to expect if you do make that fax referral is very, very important, because they're going to want to know what to expect, and the more that they know, the better the outcome of them actually picking up that phone call and enrolling in the services. This is that fax referral form that I was mentioning. So you can see this is actually our clinic fax referral form. We have one for employers and we have one for organizations, whatever makes the most sense for your setting. Provider information section is very important. You can see the patient information section there. There's actually a couple pieces that the patient or the person being referred does have to consent to. So they obviously have to say or initial that they're ready to be contacted by the Quitline. And you can see that there's another initial box down in the lower half of the sheet here that says, I do not give permission have a voicemail left. So if they're okay with having a message left from the Quitline, let's say the Quitline calls and they don't pick up, if they have this initialed, the Quitline won't leave a voicemail. If they leave it blank, they'll leave them a voicemail, and that's another way that they can know, oh, that was the Quitline, I need to call them back. And then, like I said, just the patient signature there is the final consent. So you're receiving verbal consent from this individual that they are ready to quit and they want to be referred to the Quitline and be contacted by the Quitline. Additionally, down at the bottom, there's some time frames, best time to be reached. I think that's always very important. Again, just getting back to the expectations of the individual. They're going to get a call, and more than likely, if it's checked down here that they want to be called between 3 p.m. to 6 p.m., the Quitline will call them between 3 p.m. to 6 p.m. within the next 24 to 48 hours. So we're really just talking about making the individual feel more and more comfortable and trying to make it as convenient, if you will, for that individual to get connected with these services. Now, going back to the top, to the provider information, this is specific to healthcare providers. It can be specific to employers and organizations. That top line is very, very important. And it's important because if you fill that out, let's say, you say IRHA dash specific department within IRJ, or your specific healthcare provider, and you work in the cardiac department, you're going to want to fill that out to where you can easily identify who is making that referral. So if you want to put your actual name on there along with your clinic, that's really great, because then we'll know that obviously it's you that's making that referral and not necessarily somebody else in your department. If that's too time consuming, you can put down said healthcare professional dash, or I should say said healthcare clinic dash department. And this will make more sense on my next slide when I get there, but you want to make sure that clinic name line's filled out. And if you want to receive information on the individual that you referred, you need to check the I'm a HIPAA covered entity box, which I have displayed here. And then you need to make sure you have a valid fax number, because what can happen is the Quitline can send back information to you. Basically, it's called an outcomes report, and that'll detail what took place with that referral that you just made. You obviously have to be a HIPAA covered entity if you're going to check the box yes. But that top line that I was mentioning, so in the previous example, you can see Anthem-provider name. We have a monthly report that's generated that tracks all of the fax referrals that are made to the Indiana Tobacco Quitline. The only way we're able to identify who's making those referrals is by what's on that clinic name line. So you can see here, I've put an arrow next to an example of an Anthem representative that put dash in their name, and they've made referrals, and we can see how many referrals they've made on a monthly basis, but we can also see an aggregate year to date on how many referrals they've made. So it's just a nice way that we can provide feedback to you as the provider, as the clinic, as the employer on what you've done on a monthly basis. So I think it's helpful to see, if you referred 20 patients, how many of those patients accepted the services? How many of those patients were not reached, meaning the Quitline made 5 attempts to call them and they didn't pick up? Or did they decline services? I think it helps just to give you as the provider, as the employer, an idea of your approach to interacting with these individuals. And if you need to change up your approach or change your technique to make yourself more successful with regards to getting people to actually pick up that phone call and accept those services, that's really, really key here. This is the snapshot of that outcomes report. So as I mentioned, You fill out that clinic name line. If you're a HIPAA-covered entity, you check yes, and you've provided a valid fax number. This is what you can receive back from the Indiana Tobacco Quitline on a specific participant. You can see here that you'll get information such as down in the outcomes section, you'll see status, they accepted the services. If they didn't accept the services, it will tell you declined services or unreachable. You can see what call they enrolled, or what program they enrolled in. Did they just have one call, or did they get enrolled in one of the multiple call programs? So the 4-call, the 10-call, whatever it may be. If they qualified for that free NRT that I mentioned in the form of gum or patches, that'll be detailed on here. Their contact date, obviously, of when they were contacted. And then lastly, their planned quit date. And that's really important too, to see that they've stated, yes, I'm willing to quit within the next 2 weeks. This is the date that I'm shooting for to be, or to start being tobacco free, and we're going to work from there. That date is obviously not set in stone. I think that's between the quit coach and the participant to discuss if maybe they need to push it back a week. And this gets to the personalization of the program. They can have that conversation with the quit coach, and they can change that quit date. But as a provider, or as an employer, if you are a HIPAA-covered entity, this can be some really useful information as you have follow-up visits with them to keep them engaged and to continue that conversation about their quit process. As I mentioned, quitnowindiana.com is the main consumer website. This is just a screenshot of that website. I highly recommend, as a provider, as an employer, as an organization, that you get on there and you just kind of work through the different options. There's a lot of good information about the different programming. As I mentioned, there's some nice vignettes with the quit coaches, a lot of nice informative stuff on that website. So quitnowindiana.com. And then specifically getting into the other 2 platforms that I was discussing at the beginning. So we have the telephone-based counseling option, but we also have the web-based option, as well as a text-to-quit service. Web Coach is that web-based option, very similar to the telephone-based counseling, just over the internet. So let's say you have somebody that maybe doesn't want to do the telephone-based counseling. They can get enrolled in Web Coach. It's actually equitnow.com. They can enroll in this service, and everything is done over the computer screen. Very user-friendly. I recommend visiting equitnow.com and checking that out if you have the opportunity. There's going to be more or less a web-based chat room where they'll have these counseling sessions. So it won't be the phone-based counseling sessions, but it will be a chat room-based counseling session, and they can have as many sessions as they'd like. To be honest, it's not a standard 4-call program or a 10-chat program. If they need to get on and talk to somebody or talk to their quit coach, they can fire up into their registration page and have a quit coaching session if they'd like. But again, highly recommend getting on there, navigating it, seeing what it's all about. Just another way over a different platform to keep somebody engaged with the Indiana Tobacco Quitline. This is a screenshot of equitnow.com. If you have the opportunity to get on there and kind of scan around, check things out, that's how you can do that. Then shifting into the last programming option, we have the text-to-quit service. So this is exactly what it sounds like. This is a cell phone-based service that keeps somebody engaged with the Indiana Tobacco Quitline. So if you think about it, someone can be enrolled with telephone-based counseling, with the web-based counseling, and in this text-to-quit service. To give you an idea of what this offers, you can see here that it sends up to 300 messages tailored to an individual's quit plan. So you can get quit call reminders. So you have an upcoming quit session that you're going to get a call from your quit coach. This is a great way that it can send you a reminder about that. Medication reminders, proper usage of those medications, motivational messages just to keep up the good work, tips, games. There's some mobile tracking options on there to track your tobacco usage, your cost savings because you've stopped purchasing those tobacco products. A lot of good interactive messages and options to keep someone engaged with the Quitline as they work through either their telephone-based counseling or their web-based option. A few important notes here. You have to be enrolled in either the telephone-based counseling or the web-based counseling to be able to qualify for this text-to-quit service. So you can't enroll in the text to quit service as a standalone. You can enroll in the telephone-based counseling all by itself, or you can enroll in the web-based counseling all by itself, or you can enroll in them simultaneously. But in order to receive text to quit as an option, you have to be enrolled in either the phone-based counseling or the web-based counseling. So just to kind of wind down here, I always like to show some of the Quitline effectiveness information, because I think that's really important when you have an evidence-based program to be able to speak to what are the outcomes of the program. You can see here that this is our 2015 evaluation. We have a 95% satisfaction rate. What that means is that of all the tobacco users that used the Quitline, 95% of them were satisfied with the services that they were offered. I think the real key here is the quit rate. That is a 30-day abstinence rate. So when we say quit rate, that means somebody stayed quit for 30 days, at least 30 days. You can see here of all the tobacco users that called in, about a third of them, so 29% reported staying quit for 30 days. This is really the gold standard on how you measure the effectiveness of a Quitline. In talking to our Quitline service provider, 29% is average to above average based on all the services that we offer. So all those different programming options that we just went through, this is average to above average based on those services. I think every Quitline is a little different based on what they can offer. We try to make it as easy and as user-friendly as possible to get somebody connected with this resource. So as you can see, when you look at that 30-day abstinence rate, the significance of that means if somebody can stay quit for 30 days, their chances of staying quit past that 30-day and for good significantly increase when they hit that 30-day mark. So it's really important that we collect this information and that we can more or less share what the success of the program has been. If you put that into a numbers formula, you can see that we had about just over 10,000 participants in fiscal year 2015. If you take that 29% quit rate, that's like saying nearly 3,000 people who used the Quitline stayed quit for at least 30 days. That's really, really important, because if you shift into the economic burden that tobacco places on individuals, which it varies from about 3,500 to about 5,200 annually, and that's taken from medical expenses, lost productivity, and years of potential life lost. That comes out to be about 3,000 to 5,200 per individual per year. If you look at that 30-day abstinence rate for those 2,900 people, that comes out to be about $10 to $17 million in cost savings, just from getting those individuals to stay quit for at least 30 days. Based on what we spent on the Indiana Tobacco Quitline per participant, which comes out to be about $139, I mean, those two numbers don't lie. What we're getting at here is that we know that Quitlines are best buy for public health. We know that they can be effective, that they can help people quit, and ultimately they can improve the quality of life in the state and save taxpayers a lot of money as it relates to those medical expenses, the lost productivity, and those years of potential life lost. So just to wrap up here, we know that the treatment of tobacco use needs at least the same attention that other chronic diseases demand. As healthcare providers or as employers and organizations, we highly recommend that you have the discussion with your clients, with your patients, with your employees on quitting tobacco. But you have to open up that conversation first. You have to ask, and ultimately you have to advise them on why it's important, and then refer them to an evidence-based resource such as the Indiana Tobacco Quitline. And then finally, this is just one component of a multifaceted approach to cessation systems in the state of Indiana, but it's definitely something that we're going to continue to promote and support around the state, because we know it needs to be there to help people quit, and that it can help people quit. So with that, I appreciate all of you being on today. I think we'll probably open it up to some questions. I'll let Allie kind of take that over, but here is my contact information. If you have a question and you don't share it right now, please feel free to reach out to me at my email address there, or pick up the phone and give me a call, and I'll do my best to help you out and respond to your question. So thank you.
Does anybody have any questions for Brian today? If you want, you can unmute your line and ask now, or if you would prefer, there is a chat function at the bottom of the screen. If you hover your mouse, some options should come up, and chat is one of them. We'll be able to see that if you want to type that in. Someone did ask me if we will be archiving this presentation so you can access it at a later date. We will. We've recorded today's presentation, so we have a YouTube channel here at the IRHA that we'll be posting it to. You can either find that by Googling Indiana Rural Health. That should take it to you, YouTube. But if not, I will try to have it to Tina Elliott, who is our tobacco prevention coordinator in the office. I know she can share it with a lot of people, but also we will try to have a link to it on our website somewhere.
And I'll just mention again, thanks, Allie. If you have interest for myself or Tina to come and sit down with, your clinic, your place of business, we are more than happy to come and sit down with you and talk through these options again, how it makes sense in whatever your environment is, to integrate this and apply it in your setting. We are more than happy to do that, and we can get you set up on a fax referral process to where you can really make a difference in your employees' lives and your patients' lives, and get them referred to the Quitline.
Okay, well, I'm not seeing any other questions come in. So Brian, we want to thank you for being with us today. Great information there. And again, we will try to have this video posted to our YouTube channel inside of this or early next week. So we appreciate it. Thank you.
Great. Thank you.